Hi, this is Dr. Bob Dannenhoffer. I'm the Public Health Officer for Douglas County with another of our COVID conversations today for November the 3rd, 2022. We don't have a guest today, so it'll be pretty quiet, but we do have three very interesting questions that we'll get to. So COVID has been pretty quiet actually in Douglas County. When we look at our numbers of cases, we just had 3 new cases the other day. Now, that's clearly not all the cases because there may well be people who have positive tests at home and don't get reported, or are sick and never get tested. But we get tests from some of the larger clinics, the hospitals, and from some of the larger employers in town. So we are getting test results from a fair number of sources, and the numbers seem to be low. The number of hospitalizations is also very low. When I looked this morning, there were just 3 people over at Mercy, and none are on oxygen. So that's really a good sign, suggesting that most of those people who are there may have COVID, but they're not really sick from their COVID, and that is a really good sign. In the world, what we're seeing is a steady number of cases. We were expecting a big increase in November, especially as the colder weather hit places in Northern Europe, like Germany and Poland and France. And while they're having high levels of disease, that level of disease isn't really going up as we thought it might in November. So that's a really good sign. Throughout the rest of the world is really pretty quiet. The only place that's having an increased amount of disease is in Singapore. Singapore is a very small city-state, smaller than Douglas County, that has a lot of people in it, a lot of people moving around. They have a variant called XBB, and that seems to be taking over there. Although, since most of the people in Singapore are vaccinated, they are not seeing a lot of hospitalizations and deaths. In the US, the number of cases is really very steady. You remember a few weeks ago, we talked about an increased number of cases in the northern tier of the United States and in Maine and in New Hampshire, and we worried that this was the beginning of a winter surge, but that really hasn't materialized. It's really been pretty flat in that time, and there are no real hotspots in the United States at this time. Similarly, in Oregon, the number of cases is flat or slightly decreasing. The number of hospitalizations is flat or slightly decreasing, and this is indeed what we're seeing in Douglas County. And that's all good news. Right now, most people have immunity to the virus from either prior having the disease or vaccination, or in many cases both. But still, when we look at our deaths, and we had 2 deaths today, when we look at our deaths and we look at our hospitalizations, they're almost all in people who are not up to date on their vaccine. So sometimes they had 1 dose early on. Many of the people have had no vaccines at all. But none of the hospitalizations or deaths are in the people who've gotten the booster. And that's the question here: is what's this booster all about? So the story with respiratory viruses, and we've been saying this from the very beginning of the pandemic, the story with respiratory viruses is that vaccines don't work very well, and actually prior illness doesn't work very well. So we know people can get flu 1 year and then get it again the next year. We know that with coronavirus, even before we had COVID, that people could get coronavirus and then the next year get it again. So, especially for the respiratory viruses, the booster decreases our risk of getting the disease and decreases our risk of hospitalization, but doesn't decrease it to zero. So some vaccines are incredibly effective. So like measles vaccine, about 98 or 99% effective. The polio vaccine, 98 or 99% effective. But none of these vaccines are very effective in the long run. None of the respiratory vaccines are in the long run. So remember, early on, they were about 90% effective in the short run, but that effectiveness wanes. And then what you need to do is you need to boost your immunity. And that's what the boosters are about. The second question we get is there seems to be a lot of sick people, many of whom not tested positive for COVID. What is going on here? Well, what we're seeing is the first winter where we've gotten rid of masks and most other protections. And when you get rid of masks and other protections, then other kind of viruses spread. And so we in pediatrics are seeing a lot of kids with colds and flu, colds and illnesses. Some have COVID. Some have a virus called respiratory syncytial virus, which is a virus that spreads among young people and old people. We have had very little of it in the last few years, and the reason is that what we did to prevent COVID with masking and distancing and staying home when you're sick was effective for COVID, but it was really effective for both RSV and flu. So we saw a very low RSV season in the last few years, and now those people who haven't been exposed are getting it again. In addition, we're seeing enteroviruses and rhinoviruses, which are the typical cold viruses that come up each winter, and we're starting to see some of those. So we're seeing rhinoviruses, enteroviruses, RSV, and some COVID, and that's, I think, what people are kind of sick with. At this point, among those illnesses, COVID is still far and away the most likely to put you in the hospital. We have very few people get admitted for rhinovirus or enterovirus. A few kids get admitted for RSV, but still COVID is the worst of the four that are out there. And thus our recommendation is the same as it's been all along. Go ahead and get your vaccine. If you're eligible for a booster, get a bivalent booster, get a flu vaccine if you are eligible, and stay home if you're sick. If you're sick, get tested for flu and for COVID. If you're positive for flu or for COVID, think about getting one of the antiviral drugs, which also seems to be very effective. So when we look at people in the hospital, where the people who have died, very few of them are up to date on the vaccines, and very few of them have taken advantage of the Paxlovid. The Paxlovid is available, it's free, it's relatively easy to get. So if you do test positive for COVID, get that. If you test positive for flu, talk to your doctor about getting Tamiflu. Similarly, it's out there, very effective, not particularly expensive, and really can help you get better quicker. So again, take care, be safe. Again, this is Dr. Bob Dannenhoffer, the Public Health Officer for Douglas County.